Now, one thing that did result in some paradigm shift in the last 1 year itself was the ADRIATIC trial in limited stage small cell. So we're moving from extensive stage to limited stage small cell. And what was this trial? In this trial, since standard of care for small cell lung cancer in the limited stage setting is chemotherapy with concurrent chemotherapy with radiation for 4 to 6 weeks. In this case, what they did was patients got the 4 cycles of platinum etoposide with radiation, and then randomized in this 3-arm study to durvalumab, which is a PD-L1 inhibitor in the maintenance setting for 24 months versus placebo, which is the trial that has been reported so far. The 3rd arm was durvalumab with tremelimumab, which is a PD-L1 inhibitor with a CTLA-4 inhibitor. And what they saw was an improvement, a meaningful improvement in overall survival around a 20-month median overall survival benefit. That is, durvalumab maintenance arm had a median overall survival of around 56 months, and the placebo control arm had a median overall survival of around 33 months, around a 22-month benefit. This was presented at ASCO last year by Dr. David Spiegel, and it was a plenary presentation because of the survival benefits seen. So this has changed the standard of care for limited stage small cell lung cancer. Now, some of the other studies that tried to look at approaches where they added immunotherapy at the time of radiation to limited stage small cell lung cancer and then continued it in the maintenance setting. One of the studies I want to highlight is this NRG-LU005 study, which was a phase 3 study of concomitant chemoradiation plus atezolizumab. In this case, the primary endpoint was overall survival. And unfortunately, this study did not meet its primary endpoint. There was no difference in either overall survival or progression-free survival. This was presented at the American Society of Radiation Oncology meeting by Dr. Kristen Higgins last year. So again, one trial being positive in the limited stage setting, which is the ADRIATIC trial of consolidation or maintenance immunotherapy. The other study of concurrent immunotherapy with radiation followed by maintenance immunotherapy negative. Slightly different designs, as you may understand. So the question is, when we add immunotherapy to radiation at the time of chemoradiation, does it actually have an immunosuppressive effect where the benefit is kind of lost? So again, highlighting some of the current or ongoing approaches of concurrent or consolidation. These are 2 different terms. Concurrent being when immunotherapy is added at the time of chemoradiation. Consolidation being you complete chemoradiation without immunotherapy, and then after a few weeks later, the maintenance phase, you give immunotherapy. That is consolidation. So some of the trials in this space, NRG-LU005, which I highlighted, was a concurrent trial that was negative, highlighted in X on this slide, and the ADRIATIC study highlighted with the green arrow, which was a positive study, but this was consolidation. Now, a couple of other consolidation studies that are pending is the SURPASS study, looking at another checkpoint inhibitor in the maintenance setting or in the consolidation setting. The Achilles study, which is another study of maintenance atezolizumab in the consolidation setting after chemoradiation. So these are some studies that are pending a readout. So we'll see what the data looks like when we compare these to the ADRIATIC trial, which has shown survival benefit.